What exactly is mechanical ventilation? In the ICU, it's how we support critically ill patients who can't breathe on their own. At its core, a ventilator pushes oxygen-rich air into the lungs and helps remove carbon dioxide. Different modes, like volume control, pressure support, and SIMV, adjust how much the machine helps versus how much the patient does. Think of it as a partnership between patient and machine. Understanding these basics is key for respiratory therapists, nurses, and providers to deliver safe, effective care. Want me to break down each ventilator mode in future videos? Hit like and let me know below.